The thing we're going to discuss today is the use of Clarus tolnaphthate 1%, which is an antifungal cream and nail solution. They come in two formulations, so here's the cream in a bottle. You won't have to open this up, but you basically just going to give the patient instructions on how to use this. So the cream itself is used for patients that have athlete's foot. Typically that's going to happen between the toes or in the bottom or the sole of the foot, kind of like in the distribution of if he was wearing a moccasin. And what you would do is you'd advise them to put this on twice a day. Now all they have to do is put a little bit on their fingertips. The most important thing though, a couple of drops, 1 or 2 drops, is that they rub this in completely into their skin. If they're not rubbing it in completely into the bottom of their foot, what will happen is it will actually leave moisture, especially between the toes. If you leave excess cream there, it can actually increase the risk for a worsening of the athlete's foot infection. So we want to make sure when they're rubbing that in at home, it's twice a day and they're rubbing it in completely into their skin so it disappears. The other option that we have for fungal treatment is this is called tolnaphthate antifungal solution. What it actually is used is for nail fungus, and it looks just like a lady's nail polish or some men's, whatever. We're not judging here. But in either case, this solution itself has like a little dropper in the bottom. I'm not going to open it because it's taped shut, but it comes in a little bottle. You screw the cap off. It has a little brush in there. And what you'll advise the patient to do is once a day, they'll paint the entire nail. What's very important is they get a little bit of the healthy skin on either side of the nail, so the base, the sides, and especially underneath the free edge of the nail. They want to work that underneath. About once a week after applying this, it's important to let them know they can use like a nail polish remover to remove any excess that's kind of built up over the week, because this will start to create a layer on the toe, and the more layer you create, the harder it is for the medication to work, because it actually is working on the underside of the nail where the live fungus is. So it actually soak through that nail plate. So take that off once a week, and then they just go back to that same schedule. The nail takes about 8 months to a year to grow out, so it's going to take them quite a long time to see some results. Typically we'll see them come back in about 3 months, and if we see no change whatsoever, then we can offer some of the alternative therapies like oral pill therapy or laser therapy, or in severe cases removal of the affected toenail. Okay, and that's the treatment with Clarus tolnaphthate solution and cream.